For question and answers. I guess the question is, who has a question? If you do, please put your hand up nice and high so I can see it. I don't want to miss any. I do have one right over here to begin with. And if somebody else has a question too, kind of put your hand up so that I can have the next person up.
I guess I would also offer, if we wanted to do more practice, we could do the social diet if you'd like, but I'm also happy to. I'm actually more interested in asking questions than answering questions, but you're welcome to ask questions if you'd like.
Hey, thank you for your talk. I was curious. I'm right here.
Where are you? Oh, where are you?
I'm to the left side.
Oh, okay, thanks.
I was curious when you became interested in mindfulness, and then when you started to implement that in your practice.
Mm-hmm. I became interested in mindfulness probably, almost 17, 18 years ago, just as more personal practice, and having some friends who were regular meditators, and was just drawn to their sort of presence and the qualities they exhibited in working with their patients. They were also physical therapists. So I got intrigued by that. And then I guess, really within the last 10 years, as you may know, mindfulness is, pretty mainstream now. It's pretty well accepted. And so probably within the last few years, I was like, I could actually integrate this. I can actually talk about my personal practice and investigate it in my research. So that's, I guess, how that all unfolded. Yeah.
Our second question was over here. And
I just can we read the poem?
Oh, wow. Would you like me to read the poem?
Yes, please. That's my question.
Okay. I put this away. I should have this memorized. I've said it so much, but. So this is, if you're teaching mindfulness, it's often trickled with poems, metaphors. I think things settle in, sink in a little bit. So this is one of my favorite poems by Derek Walcott, Love After Love. The time will come when, with elation, you will greet yourself arriving at your own door, in your own mirror, and each will smile at the other's welcome and say, sit here, eat. You will love again the stranger who was yourself. Give wine, give bread, give back your heart to yourself, to the stranger who has loved you all your life, who you have ignored for another. Take down the love letters from the bookshelf, the photographs, the desperate notes. Peel your own image from the mirror. Sit, feast on your life. Okay, great. I'm glad I got to share that with you. Thanks for asking.
So, I believe there was another question right up here towards the front. While the microphone's coming over here, it seemed to me that you incorporated several different types of movement, that the movement that we used was maybe inspired by several different types of practice. I was wondering if you could just talk a little bit about why you chose the ones that you did.
I don't know if I had a lot of, some of the movements I guess would be classified as more Qigong, flow-like. There was some mixture of yoga, Tai Chi in there. Movement's movement, slow movement, breath connecting to the body. I just thought that was, given, I suppose, their space and what we had, I thought that'd be a nice mix. So, yeah.
Right over here. Hi. So when I hear of mindfulness in the popular media, oftentimes it's presented as something that we should all be doing, and it's good for everybody. I wonder if there's any literature on adverse experiences, if there's a population or categories of people that this is not a good idea to recommend, or any other kind of cautions that you might offer.
Yeah. It was originally developed for, John Kabat-Zinn originally developed mindfulness-based stress reduction for the chronic pain population. I would say that, I don't know if there has been a lot of reporting of adverse events. I do think that, for people, again, more just personal experience in teaching and leading, it can be sometimes more challenging for people that have migraines or headaches, sometimes, again, that are very sort of sensitive to stimulation, can find that practice a bit more challenging or difficult. Not to say that they have any serious adverse events from doing it, but it can be a very frustrating practice for them. And there are also options to, again, not focus on the physical sensations of the body. You can focus on other objects of attention. So for certain people, it might be, vision or hearing. I mean, it can be very exposure oriented, and oftentimes when people, if you work with patients with pain, they want to avoid being present with their body, and so it can be confrontational, and I think approaching it with some gentleness and giving people other options of attention can be helpful, and oftentimes maybe the movement practice can be an easier transition before getting into a sitting practice.
We have a question online and back.
Yeah, this question comes from Crystal. John Kabat-Zinn is famous for his work in dealing with chronic pain patients. He's written a book, Full Catastrophe Living, and has a guided meditation DVD that I refer to often. Do you have resources like this available that I could suggest my patients look into?
I'm sorry,
Do you have resources that, like guided meditation DVDs or something like that, for this person's patients to look into?
Oh, yeah. Well, sure, yeah. So you referred to the mindfulness-based stress reduction program. On that link, you can find a certified mindfulness-based stress reduction teacher in their area. They also have some online programs that you can enroll in online. I don't know if I have that slide, but anyway, yeah. There are certainly online programs. There are also local programs in MBSR if they wanted a formal 8-week program. Or there's also kind of local retreats and meditations. And again, I have the links I could share with you there for all those resources.
We have another question right in back here on the right side.
Thanks, Nick. I've got a couple of things. I suppose the first thing is I noticed a lot of Buddhist iconography in your slides, and I wondered, so I use it in London, and we're cautious not to be overtly adherent to any particular philosophy or religion with it. I wondered whether you encountered much resistance to that. And then my second question is whether you think it's possible to introduce or signpost people to mindfulness without practicing mindfulness yourself.
I didn't catch the last part. The first part I caught, which was, are you careful to make when you are teaching mindfulness, say, to patients or within an MBSR program to kind of keep it secular, not bring in a lot of the Buddhist philosophy and psychology? Absolutely, yes. I bring some of this up just more as a background for clinicians, just to get a sense of the foundations. But yeah, absolutely the intention really was with the development of MBSR to deliver it in a very secular manner. I think it can be helpful just to get a little bit of sense of some of the underpinnings that are embedded in that secular practice. So I bring that up for this talk. But yeah, patient practice, absolutely. There can be some connotations in terms of, does this jive with my religious practice? And that can be a real important discussion to have for people that might be turned off to meditation. Yeah. And I usually frame it in it's complementary to whatever spirituality you have, and tend to not bring in a lot of the Buddhist psychology or philosophy. Yeah.
Thank you. And the second point was just your thoughts on people guiding patients who don't practice themselves personally.
I'm not sure I heard you.
So what your thoughts are on people who guide people in mindfulness if they don't practice themselves personally?
What do I think about that?
Yeah.
Well, I think it's really important to be an effective teacher to embody the practice and to have a formal practice as well as informal practice. And that's why I think it's helpful to find someone who's qualified, certified, has gone through supervision, teacher training, and I think the teacher facilitator is a really critical part to the outcomes of those groups. So yeah, I would encourage people that are wanting to teach mindfulness to practice it themselves.
Thank you.
We have another question coming in from an online participant, and then we had somebody sitting just a few rows further. Okay, thank you.
This question is, what do you recommend in terms of the frequency and or duration of a mindfulness and compassion practice?
Mm-hmm. Yeah, pretty common question. I typically say that a moment of mindfulness is better than no mindfulness whatsoever. So any practice you can bring in, whether even if it's informal mindfulness in everyday activities, and I'll oftentimes kind of give a little worksheet on ways to integrate mindfulness into everyday practice. That can be helpful for some people. I think, to me, I want to meet people where they're at. If you are entering, say, a formal program over the course of 8 weeks, it's a gentle introduction into maybe a 5-minute sit and progresses eventually into a 45-minute sit, and also within that even a half-day retreat. It can be challenging for people to sit for 20, 30, 45 minutes. I think there's been some research that suggests that even 15 minutes of practice can have some beneficial effects to the body and mind. So I guess my general answer to that is see where you can fit it in and build your practice from there. And it's to also appreciate that it's very common to have, to cycle through this, to have a good practice for some time and to let it drift away and to return to it. And so there's ways to manage that, to sustain your practice. And I can chat about you with that in terms of just creating space. There's a lot of the 10 points things, but just creating space for you and sometimes connecting with community, going to a weekly meditation retreat or scheduling in a retreat every year or two. There's lots of ways to problem solve around that. But sitting with people is very, very supportive and helpful for people that find just an individual practice to be challenging.
Great. We have one last question.
Hi.
Hi.
Thank you for the guided movement. That felt really good. I'm curious if there's research on, or what are your general thoughts on combining mindfulness practice working with patients during touch and manual therapy?
Oh. I don't know of any. Well, I mean, I certainly will use, if I'm doing an individual consultation, certainly feel fine. If I've worked with the patient for a while, giving him some biofeedback, to the belly or whatnot. But yeah, typically it is not. You're right. Typically it's not integrated so much with touch. I guess because, again, the idea is really to how can you increase internal locus of control, self-efficacy, trusting your own body. But I think it can pair very nicely. And I certainly touch my patients when it is in sort of that right context, and they're inviting me to do that just to facilitate probably more the interoceptive sort of aspect, So, but I don't think it's a contraindication.
All right. Well, I hate to say